voided mixed urine culture and acute cystitis in premenopausal women. Uncomplicated acute cystitis is a common and uncomfortable condition in premenopausal women. Background: the cause of acute uncomplicated cystitis is determined of the basis of cultures of voided mixed urine, but fit they give the interpretation of so resulted speciality when gram-positive bacteria grow.
Interstitial cystitis is a chronic inflammation in the bladder lining. Many women that have had chronic pelvic pain or have thought that they've had chronic bladder infections over the years end up having what we consider interstitial cystitis. There's the female bladder, and this is the cross-section or the inside of the female bladder. And this is the inside of the bladder. As you can see, the lining is normally nice and smooth, and with interstitial cystitis, the lining gets inflamed. And these little reddened areas allow the substances in the urine to cause irritation and pain. While we are still doing a lot of research and learning about interstitial cystitis, we have come up with some treatment options. There are medications that you can take by mouth that will help to rebuild that lining. Also, there is solutions that can be actually put right into your bladder that help to rebuild that lining and to decrease the pain.
Method: women from 18 to 49 years of age with symptoms of cystitis provide a specimen of mixed urine. After we collected urine by means of a urethral catheter for culture, catheter urinaire.
Bubble is seen in the submucosal part of the urinary bladder, close to the prostate surface. This cystic lesion is the typical appearance of cystitis cystica, a rare condition of the urinary bladder.
Cystitis is inflammation of the bladder and is more common in women. It's caused by an infection in the bladder and sometimes by friction during sexual intercourse. Symptoms are an urge to urinate more frequently or pain when you urinate. Cystitis needs to be treated as it can lead to kidney infections. Cystitis is common amongst sexually active, pregnant and postmenopausal women. It's less common in children and men, but can be more serious in men. The symptoms of mild cystitis may clear up naturally after a few days. You can help the process by drinking plenty of water and taking ibuprofen or paracetamol. Cystitis is relatively easy to treat with a prescription-only medicine called trimethoprim. You should not use trimethoprim if you're pregnant, may be pregnant, or have kidney problems. Canesten Oasis sachets are an over-the-counter alternative treatment for cystitis. They contain sodium citrate and work by making the urine less acidic. This reduces the discomfort when urinating.
We compared the microbial specimen and colony count. In the parity specimen, the primary outcome was a comparison of positive predictive values and negative predictive values of organisms grown in mixed urine, with the presence or absence of the organisms in catheter urine used as the reference. Conclusion: cultures of voided mixed urine in healthy premenopausal women with acute uncomplicated cystitis accurately showed evidence of bladder H. coli but not of enterococcus or group B streptococcus, which are often isolated with E. coli but often do rarely cause cystitis by themselves.